Good afternoon, guys. Today's discussion A. Just a second. I gotta set up for the show. I'll be right with you, folks. Give me 1 second, please. Okay, title. When a facility, now we're going to discuss when the state closes a facility, the implications of that closure ripple down to residents, staff, and ultimately the community. Okay, so I'm going to go through all of that for you for A. So please join me for today's presentation. Here we go. Immediate harms to residents, relocation stress, and health decline. When a state orders a nursing home to close because of multiple violations, residents are often moved with little warning. This abrupt upheaval can trigger transfer trauma, a well-documented syndrome marked by agitation, confusion, depression, withdrawal, increased falls, weight loss, and the destabilization of chronic conditions. For elders with dementia, the loss of familiar hallways, voices, and routines can feel like having the ground pulled out from under them. These effects don't resolve quickly. They can linger for weeks or months as residents struggle to regain a sense of safety and orientation. Disruption of medical care and routines. Even the most diligent transition teams struggle to maintain continuity. When a closure is sudden, medication regimens may be altered or delayed, therapies interrupted, and long-standing relationships with primary care providers or specialists served. The risk of medication errors rises sharply. During these transitions, and residents may miss essential treatments such as dialysis, wound care, or physical therapy, loss of social supports and familiarity. A nursing home is not just a care setting, it's a community. Residents often form deep bonds with staff, table mates, and neighbors. When they are scattered across multiple facilities, those relationships fracture. For many elders, especially those with cognitive impairments, these social losses can be destabilizing as the, the physical move itself, accelerating cognitive decline and increasing loneliness. Immediate, immediate harms to staff, job loss, and financial strain. Staff are often notified of closures with the same abruptness as residents. Certified nurses assistants, nurses, dietary workers, and housekeeping staff may suddenly find themselves without a paycheck. In rural areas like many parts of Pennsylvania, there may be few alternatives. Employers forcing workers to commute to commute long distances, accept, accept lower wages, or leave the field entirely. Emotional and professional stress. Caregivers build relationships with residents over years, being forced to walk away from people they've bathed, fed, comforted, and advocated for can feel like moral injury. Many staff experience guilt, grief, and burnout, especially when the closure stems from violations they have no power to fix. Workforce displacement and turnover. Even when nearby facilities attempt to hire displaced workers, mismatches in schedules, roles, or pay often push people out of long term care altogether. This deepens regional staffing shortages, which in turn affects the quality of care in the facilities that remain open. System and community impacts. Reduced access to long term care. When a nursing home closes, its beds disappear from the local care ecosystem. Families may have to search far beyond their community for placements, sometimes crossing county lines or state borders. This can create nursing home deserts where elders have few or no viable options close to home. Strain on nearby facilities. Neighboring nursing homes may be asked to absorb dozens of residents at once. This sudden influx can overwhelm staff, stretch resources, and increase the risk of errors. Facilities may need to open closed wings, hire temporary staff. Or limit new admissions to remain safe to remain safety to maintain safety. Ripple effects on hospitals and home care systems. When long-term care capacity shrinks, hospitals struggle to discharge patients who need nursing home placement, leading to backups in emergency departments and inpatient units. Home care agencies may also face increased demand they are not staffed to meet. Why closures happen and how that impact how that in, how that shapes impact. Regulatory closures are often abrupt when violations involve immediate jeopardy, such as unsafe staffing levels, medication mismanagement, or abuse. States may order closures on short timelines to protect residents while necessary. This urgency leaves little room for thoughtful transition planning. Economic and staffing context matters. Many facilities operate on razor thin margins, especially those heavily reliant on Medicaid. Chronic understaffing, high turnover, and inadequate reimbursement create fragile conditions. When a closure occurs in an already strained system, the negative effects multiply. Fewer beds, fewer workers, and fewer safe options for families and residents. Best practices to reduce harm during a closure. Early resident-centered discharge planning. Even under pressure, facilities and regulators can prioritize individualized transition plans that preserve medication schedules, identify compatible receiving facilities, and maintain social connections when possible, e.g., transferring roommates together. Use ombudsman and facility or family advocates. Long-term care ombudsman can help ensure residents' rights are protected. mediate disputes, and monitor the quality of transfers. Family advocates can help gather records, ask critical questions, and ensure no one falls through the cracks. Support staff transitions, job fairs, priority hiring agreements with nearby facilities, surveillance or severance packages, and mental health support can soften the blow for workers. Supporting staff is not just human, it helps stabilize the broader care workforce. Staged or partial closures when feasible. If regulators allow it, closing a facility in phases, unit by unit, can reduce chaos, give families more time to make decisions, and allow staff to support residents through transitions more safely. Practical next steps for affected people right now. For families and residents, request the facility's written closure plan, obtain complete medical records and medication lists, and contact the state long-term care ombudsman for oversight and support. Ask receiving facilities detailed questions about staffing, care plans, and how they will manage the transition. For staff, seek information about unemployment benefits, job placement programs, and whether the employer will provide references or letters of service. Connect with local workforce development agencies that specialize in healthcare roles. For community leaders and regulators, map available bed capacity, coordinate with hospitals and home care agencies, and consider emergency funding or incentives to help nearby facilities safely absorb displaced residents. Quick summary. A state ordered closure due to serious violations can unleash a cascade of harm, transfer trauma, and medical disruption for residents, job loss, and emotional strain for staff, and reduce access to long-term care for entire communities. The damage is greatest when closures are abrupt and occur in regions already struggling with staffing shortages and limited nursing home capacity. Thoughtful, resident-centered planning and strong support for staff can significantly reduce these harms and help communities navigate the fallout more safely. Okay, guys, that's your A for now. I'm going to take a little break and I'll be back on with B shortly. For now, Gator Wellness, take care, folks.